This is Chris Stevenson. We're here on the network again, and we're going to talk about the aftermath of the historic legislation that was passed on health care. Chris, how you doing today?
Good. How you doing, Pat?
Well, we've seen a lot of controversy involved with the passing of health care, and you know, one thing I've noticed is that a lot of people are not educated on the history of health care itself, Chris.
Right.
Knowing that this goes all the way back to 1854 with President Franklin Pierce and the activist Dorothea Dix. She proposed health care legislation which was shot down by Franklin Pierce during that time.
Mm-hmm.
And every other president since then has had to deal with this issue.
Right.
President Obama comes in 13 months. He passes historic legislation that will cover at least 32 million uninsured Americans, when you still have 47 million right now that are uninsured, that now are going to be insured. Why are we seeing such a negative response? People talking about leaving the country. Rush Limbaugh said he would leave the country, but he hadn't left yet. And why are we seeing this type of reaction? And what is it really based on?
Well, I'm glad you mentioned Rush Limbaugh. I'm waiting for him to leave the country. And maybe if he calls me, you know, maybe he's waiting for a phone call or whatever, I don't know.
We can get him to go.
We can get him to go. We can get him to go. And take Hannity, take Michael Savage, take a few others, Glenn Beck, they can all go too. But as far as why we're seeing this kind of opposition, here it is, you have the first black president.
Yes.
Other white presidents, all the presidents beforehand have talked about it. There has been a desire by some, such as Clinton and Carter and a few others, to actually get it going.
Right.
Some way or another, they were met with personal problems that didn't allow them to finish this project. Obama comes in and he not just talks about it; he is determined. This is the same kind of determination I wrote about on the tweets website,
right?
Which they talked about, and it even went into a lot of history that you talked into, because you went into Franklin Pierce, you know, and I discovered the same thing. You know, this way back in 1854, he was the first president to shoot this down. He didn't like it, but it was brought up by an activist,
right?
Okay, and since then it has been a hot potato issue over the centuries. So, you know, what we're seeing today, you see a black president do it. A lot of people hate it, but they're not just come out and saying we hate it because a black president is the one that basically rescued this country's health care problems, which is what's going to happen in the long run. But, you know, I get the feeling that, especially since the last weekend, what I've been hearing reports of, these so-called Tea Party people. You know, the people in the Boston Tea Party seem to be a whole lot smarter than these guys today. Okay?
Yeah.
But these guys today are hurling racial epithets and everything at black lawmakers.
Yeah, John Lewis. They used the N-word on his way to the Capitol.
They used the F-word on Barney Frank. You know, these people, I'm going to tell you something. There was an interview done by a couple of college kids.
Right.
They were around the state capitol also in the White House, and they interviewed some of these Tea Party people.
Right.
He asked them, where did you get this information from? Mm-hmm. They would say, well, either the Glenn Beck Show or Fox News.
Right.
So all of this, I was amazed by all the anger that can be produced, that can be displayed by people just from them listening to right-wing talk radio.
Misinformation.
Yes.
Just misinformation.
Just misinformation.
Why is that so prevalent with this situation? This is one thing I was looking at, Chris, that bothered me a lot. We talked about it on several occasions. What people don't realize is the uninsured cannot be denied health services.
Right.
If their primary care is the emergency room, you and I that have health care insurance are going to have to pay for it.
Right.
And that's what people aren't realizing. Unless you do something about the uninsured, your premiums will continue to rise because their primary health care is the emergency room.
Right. And so, you know what? Dennis Kucinich said years ago, that we've been paying for universal health care anyway. We just haven't been receiving it.
Right.
So what happened is, what's going on here is you've had the company, and understand their stocks have risen over the last several months.
Absolutely.
While the Tea Party has been complaining about this, and right-wing people have been complaining about this, the health care companies, the insurance companies have been raking in
big money.
Big money.
Big money.
So, and that's the silent truth about this whole affair.
Why is the fact of the matter, too, Chris, is that bothers me, is that people aren't educating themselves on the facts. At one point in history, close to 40 years ago, I wish people would look up, there was a situation that arose between President Nixon and then Senator Kennedy, which almost produced the Kennedy-Nixon healthcare compromise. Mm-hmm. But that fell apart.
Yes.
As you know, the Kennedys were always, one of their biggest pet peeves was a healthcare universal program. Right. And that program was almost done by then President Nixon, who was a Republican. And they almost had a healthcare compromise in the early 70s. That fell apart. Mm-hmm. Carter tried it. Fell apart. It was tried under Clinton, fell apart. Right. Bush really didn't care, but he did look at the issue, but never really tried to champion it. Mm-hmm. Here you come President Obama, who has probably passed more legislation at this point right. than Clinton and Bush combined. That's right. Comes and does health care, and they've been trying to do health care for well over 150 years.
Right, right. Now, see, understand the tenacity of President Obama. That's one thing I appreciate about him. Okay,